Hi, my name is Michael Chikeen. The smartest people I've met have one common belief, that us silly humans really don't know much. For example, we still don't know why planes stay in the air, or how Tylenol or even gravity works. Yeah, gravity. Look it up. In today's distracted, clickbait, misinformation age, I wish we could all be less certain, more humble, and a lot more curious. Admittedly, I've been known to struggle with all three. So no more, no less, this show is my attempt to be that change. Thanks for joining me, and here we go. Hey everybody, welcome back to No More, No Less. I'm your host, Michael Chikeen, and today in the virtual studio, I'm joined by Shai Hipperson. Shai has a master's of psychology and is the principal psychologist and clinical psychedelic-assisted therapist at the Conscious Mind Center in Queensland, Australia. Her work focuses on complex trauma, PTSD, substance abuse, and chronic illness. Shai approaches her work from her own journeys through recovery from chronic pain and PTSD. And just to set the stage, outside of approved clinical use, psychedelic-assisted therapy remains strictly prohibited and illegal in Australia, as it does in most countries. However, in Australia, you can access this new type of care if you have a diagnosis of treatment-resistant depression or PTSD. Today, we'll explore what integration really means, how the process of psychedelic-assisted therapy is evolving and what it looks like right now, how body, mind, spirit therapy works in practice, and we'll explore psychedelic-assisted approaches and why they're both promising and potentially perilous. So Shai, I'm so excited. Let's dive straight in. Welcome to the show.
Thank you so much for having me, Michael, and I look forward to this conversation.
So I guess we can start, at the beginning. How did you go from clinical psychologist, talk therapist, if you will, into this new world that is very quickly evolving all over the world?
Yeah, and I guess my pathway is not really linear from what most people would expect psychology training. I actually came across a MAPS study. I believe it was a phase 2 study back in 2016. And at the time I was in my undergrad psychology studies. It was a sheer accident, maybe luck, maybe fate, I'm not sure. But from that moment on, it really changed the trajectory of where I was going with my clinical practice. I always knew I wanted to be a clinical psychologist when I started university. We can come back to that because I never intended to go to uni. But in terms of the psychedelic therapy and how helpful it has been shown in mental health and treating hard to treat conditions, my passion's been there for years and years. And I'm just so blessed to be in Australia at the time where we led the world in rescheduling these medicines for clinical use.
Right. And I guess let's just set the stage. What psychedelics are you using in your practice right now? I know MDMA is the big one for PTSD, but I'm wondering if there's other classifications that you're allowed to use in Australia.
Yeah, sure. So in Australia, ketamine is commonly used. Many years ago, the local hospitals actually had ketamine programs for people with treatment-resistant depression that they could go and get treatment in the hospital. It wasn't necessarily inpatient treatment, but more or less outpatient monitored in the hospital setting. Ketamine is still widely used today. There are a few clinics around that offer intravenous ketamine, and there are a few more psychiatrists coming on the scene to offer troche ketamine, which is a home-based treatment, obviously under very strict medical conditions, under very strict adherence to what that looks like. Again, access is very restricted to the people that it needs to be accessed to, really treatment-resistant depression. I have seen it used in PTSD as well. So ketamine is one. Two is psilocybin. Psilocybin has been approved by the TGA in Australia, so the equal to the FDA in America, around treatment-resistant depression. We have just gone through a new submission period, which closed 5 days ago, actually, to have psilocybin rescheduled for end-of-life anxiety for oncology and cancer patients. And we're yet to see the outcome of that, but it would be amazing to see that added to the list of people that can access this treatment in Australia, and MDMA, as you mentioned, Michael.
Right. Interesting. To go back to ketamine for 1 second, how can it be under like strict medical guidelines or observation if it's done at home? isn't there a risk for people just like Eloning Musk themselves into oblivion on ketamine? And how is there sort of safeguards or,
Yeah,
precautionary?
sure. So I can only speak to what I know, and many psychiatrists have probably their own way of approaching ketamine. But what I do know from a few psychiatrists that are familiar with it, that I do know, they actually give people a 50 milligram dose in the clinic the very first time. They monitor their blood pressure, their heart rate, and they just monitor for any adverse symptoms. So any anaphylaxis, any shortness of breath, changes in orientation that would be unexpected for ketamine. We know that ketamine makes people disorientated. So, being able to walk in a straight line is obviously not a good example of someone having an adverse reaction to it. If someone can show or demonstrate that they are okay with ketamine, which we call troche, in the clinic, the psychiatrist will then typically prescribe maybe a 1 week worth of dose or 1 month worth of dose. And it's regular check-in intervals. So you might see the psychiatrist monthly for a few months while you're starting the ketamine treatment. And then it might taper off to you see the psychiatrist every 2 or 3 months. The ketamine medicine itself is usually restricted by the pharmacist, and only provided as needed based on your script. So I guess it's really a trust relationship there too.
Right. So a patient would get let's say at the minimum, a week's worth of dosage. And so the treatment is every day?
It
Like every day?
depends. So
Okay.
it depends. Sometimes it can be. Sometimes it can be every second day, maybe every third day. It depends on
Wow.
how the psychiatrist views access to ketamine, what the patient's presentation is, how they're responding to the ketamine, and then the dosage amount gets titrated up and down. In America, I think the highest dose I've seen prescribed for take-home treatment is about 1,200 milligrams, which is astronomically huge. In
Yeah.
Australia, we're capped at 400 milligrams, which, do not get me wrong, is an absolutely massive amount.
Right.
But if you take ketamine for a longer period of time, so 6 or 12 months under your guidance of your psychiatrist, you can start to develop a tolerance, which means
Right.
you might need to increase the dose. The psychiatrist might need to increase the dose to continue to get those benefits of the neuroplasticity in the brain.
I mean, 1,200 milligrams does sound like an incredible amount. I mean, leave it to America to really overdo it.
No
Unbelievable.
comment.
Yeah, well done, well done. I guess so. How do you decide which sort of patient needs what specific type of psychedelic? As I mentioned before we start recording, like when I had two sessions, one was MDMA and the other one was MDMA and mushrooms combined. And the as you said, this was done underground. This was not legal. It was done in Canada. There's no legality for this process. It was administered by a therapist, and there were people sitting in the room, and they did it. I think they adhered to some MAP scheduling as far as having some talk therapy beforehand to have set and setting, having people in the room that you know and trust that you've met before. Like they did their best towards it, and I had mostly good experience. But the MDMA session was vastly different from the MDMA and mushroom sessions, like different planets, if you will. So I'd love to hear how someone comes in and you're talking about what they're in for, what they're curious about, taking these sort of plant medicine, if you will. Yeah. How do you delineate who gets what?
Great question. Before I jump into my answer, do you know what dose you were given with your MDMA and psilocybin combo? Just out of curiosity.
Um, yeah, I'm not totally sure. So I think the MDMA was a smaller amount than when I did the full dose. So
Sure.
and I can find out. That's a great question. So maybe it was 60 or 80 milligrams. I don't think it was a full MDMA dose, which I believe was 100 and something. And
Yeah.
then they originally suggested 4 grams of psilocybin, and I was like, that sounds like a
Which is
lot.
huge.
Eh,
Yes.
Yeah,
5
and
grams is considered hero dose in terms of dried
right,
psilocybin. So yeah, 4 grams is huge.
Right. Okay. Yeah. Maybe we'll get into this right now then. So it was four, and there was the guy who he was a Gestalt therapist and a very nice guy, but there's something I felt uneasy about him a little bit, and so I'm like, let's just do two doses because that sounds like four sounds like a ton. So let's do two, and then I did both, and then during uh the session or whatever, the full day, I went through. I maybe had 1 hour where I was super paranoid. Where I was like, "This motherfucker gave me 4 grams. He didn't tell me," and so I really like. Thankfully, there's one woman in the room who was seemed like a safe space for me at that time. And so I got a little paranoid, and I was even got up to go to the bathroom, and I had an episode where I was thinking like, my whole life I avoided these sorts of drugs, and now these mushroom people got me. They got me. Here I am, and I'm under their spell now, and it took me a bit to come down from that. And overall, I think I greatly benefited from some of the, I don't want to say wisdom, but like perspective I got from that journey. But it took me several months for the anxiety to taper down after that. After that, yeah, I always tell people MDMA, I see a lot of benefit in a clinical setting. However, like the psilocybin, especially maybe at the dose I had, or maybe it's the conjunction with MDMA, I say I don't know. This is like the microdosing psilocybin. I found good benefits for, like going for a hike with friends, and all things like that. But that was a hell of an experience for me.
I could imagine. And and the doses as well sound very high for what they are. So as we know, like the MAPS protocol, MDMA is about 120 milligrams, and then maybe a 70 milligram top up if required, depending on
Right.
the person. So everybody's going to be very different. It's a myth around body type, body size, and gender and age.
Mm,
Everybody metabolizes medicine very differently, and these medicines are no different. And that said, when we're talking about psilocybin, with the clinical psilocybin, I believe the dose is 25 milligrams of psilocybin itself. So they've actually extracted it all out of the mushroom, and it's just the straight psilocybin, like the
wow.
psilocybin, I believe is what it's called. Yeah, so like in the clinical setting and the way the pharmaceutical world has been able to extract these medicines and develop them really takes a lot of the guesswork out because the doses are very standardized.
Right.
But don't think that they don't do the same. They don't pack the same sort of punch, if you know what I mean.
Sure. And so it's how many milligrams of psilocybin do they
I believe
administer?
it's 25 milligrams of psilocybin. So it's actually the psychedelic side of the psilocybin. So
Right.
if you
So
look
it's
at the
two and a half
mushroom,
grams, right?
I believe it falls around there to 2.5 to 3
Okay.
equivalent dried psilocybin, I believe, is what the equivalent weighs out to be. Don't quote me on
Right.
that
Yeah.
though.
And they never combine them, I would imagine. They never.
No. So
No.
I guess going back to your question before around screening. So
Yeah.
we are regulated from the TGA in Australia, who set the rules of who can access these medicines. It's very clear. You must be over 18. So you've got to be considered a legal adult in Australia to access these medicines. You need to meet a criteria of treatment resistant depression or treatment resistant PTSD. What they consider treatment resistant in Australia is you've tried at least 2 courses of antidepressant or anti-anxiety medications and or with a round of therapy. So generally cognitive behavioral therapy, or CBT as people are used to its acronym name, or some other form of talk therapy. If people have not been able to improve their symptoms based on those kinds of criteria, and as long as there is no immediate or secondary family history of psychotic related disorders, you
Right.
meet the eligibility criteria from the TGA. But under the TGA, each psychiatrist and clinical psychedelic team will have their own criteria for people to meet. And this is based on the comfortability of the team. This is based on, our insurances. This is based on what's accessible to us. We have to remember in mental health that comorbidities exist. It's very uncommon that you see someone with just straight depression and nothing else. you often see people with depression, anxiety, and maybe some substance addiction or misuse.
Right. What do you think about? Yeah, because that's all super fascinating for how they say that you have to try antidepressants first before you go
Yes.
into. So, and I think what we've learned, and definitely correct me where I'm wrong, in the last 30 40 years of these drugs, like some of them just aren't as effective as, let's say, even exercise, for example. Or if you're between 18 and 25, those are very those are years laced with anxiety because just growing in the world, and there's so many things that happen during that time. What do you think about having to put someone through a course of antidepressants and anti-anxiety medication that has so many lists of side effects before going and trying something like MDMA or psilocybin, which are relatively safe, at least from like a physiological point of view? I think there are some risks with psilocybin, with maybe a very bad trip or a mental break or stuff like that. But those are super rare as far as I know. Whereas antidepressants, we know that there are a whole bunch of side effects. So I'd love to hear what you think about that protocol from the government.
Yeah, I understand the protocol from the government because basically the medications from an SSRI or an SNRI perspective of the antidepressant, anti-anxiety is considered first-line treatment. Should they suggest therapy as the first-line treatment to just see and then maybe medication second? Maybe. The research supports that as being quite a strong argument. But in Australia, basically the antidepressant medication, anti-anxiety medication is considered our first-line treatment. So I understand why that is a requirement. I don't disagree with it. If we're trying to differentiate treatment-resistant versus a depressive episode, we have to find a distinction. And as myself as a clinician in this space, compared to my colleague, who is also a clinician, compared to my next colleague, we may all have a very different personal interpretation of what treatment resistant is considered as.
Okay.
So if we have that standard, I suppose it kind of helps the industry overall be able to have something to work with as a standardized approach.
Okay. So you think maybe in the future we might have a better idea of, okay, let's go right to psilocybin. So this is just like stage one of everybody accepting these medicines. Okay.
Maybe. So there was actually a really cool study. I'll see if I can find it for you to put in the show notes for your listeners. I think they might be interested. The Imperial College of London did a study of escitalopram, which is a very common SSRI antidepressant medication, compared to psilocybin. And they also recently just released the follow-up. So they put people through escitalopram, I think it was for 10 weeks, and then another group had 2 doses of psilocybin over a 10-week period. What they found was at the end of the first trial was the difference in depressive symptoms between both groups basically dropped at the same rate. But what happened at follow-up was they found that the people in the psilocybin group had a better remission rate. So they stayed in remission from their depression. It didn't remit or relapse.
Right.
They also had broader perspective of themselves. They were more open to experiences. They felt more positive about their relationships and the world at large. So in terms of outcomes long-term between a standard antidepressant and the psilocybin over that very short period of time was quite significant from a personal perspective and a personal growth perspective. Some patients may have a lot of anxiety, quite rigid thought patterns, which can really prevent someone from letting go in those situations of being under the medicine. So with MDMA and psilocybin, although you don't get the full visual experience under MDMA like you do psilocybin, they're quite different. What can happen is if somebody's quite rigid in their thought processes under the psilocybin and they haven't had enough preparation, or maybe with all the preparation in the world, it's still not enough, it can actually lead them to having quite a difficult experience, whether they're being supported by the facilitators and therapists in the room or not. And they may be the people that would better suit maybe a little bit of ketamine before to get the idea of kind of letting go. And that notion of letting go under medicine therapy is really important. What you fight persists. The medicine will show you what you need to see. And that's what makes these medicines so powerful, but also a little bit scary on the same hand because there's no control.
I mean, I
We as
can
the
relate to
clinicians
that.
can't control where it goes,
I
right?
can relate to that completely. I mean, I even
Yeah.
someone I spoke to afterwards who was part of the session. This woman, she also, well, I grew up in a Catholic environment. Like we weren't super religious, but went to church every week, yada yada yada. So there was all this element of like Catholic control and judgment. And she came from a much more stringent conservative environment, and so she really related to how I came into that psilocybin session, because I was really worried about like giving up control to these medicines, or substances, I think is more appropriate for how I see them. And so I didn't sleep much the night before. I got there, I was a little bit frazzled, and then we had the combination of these two substances. And again, I really value what I took away from that experience, but like it was quite harrowing when I went through it. And I was in a time in my life where I was, a month away from moving away from my country. I was in quite a difficult relationship at that time. And so it seemed like the 6 months afterwards, my anxiety levels were like significantly higher as a baseline moving forward. And it took me a while to be able to come back down to where I was beforehand. And so I definitely understand and really believe that there should be these protocols, and that if it's underground, there's a lot of things like you trust these practitioners who, I think a lot of them think that they're acting as God, and they should just get as much of this substance into these people as possible because it will help no matter what. And I do not agree with that. I mean, I've heard, to talk about the U.S. again, I have friends in the U.S. who are trying to overcome things like PTSD or some complex trauma or whatever, and they were going into these practitioner-led underground psychedelic sessions where it's a house filled with 10 people, everyone's in a different room doing all their different substances. And they said it just seems so fucked from the outset that you don't know all these people, so your trust and safety level is already half of what it would be if you're in a clinical setting with a therapist you've spoken to. You understand that they're there to help you, they have protocols if something goes wrong. Or if you're in somebody's a townhouse with seven other people that are going through these very traumatic experiences. I mean, I would have lost my head if I was in an environment like that. So yeah, I love seeing all the research, especially from people like you, that realize that there should kind of be guardrails in place so there is safety for people going through this very uh, it can be traumatic, I guess, experience to
It
go into
absolutely can
themselves.
be. Yeah,
Right.
absolutely can be. And I think you raised so many important points there that I want to pick apart a little bit.
Please.
So one of them was really around the level of anxiety you felt after your experience. So for me, that is something that I would consider harm. That would be something I would consider a psychedelic harm or medicine harm. So that is a lot of the supportive work that I have done with my patients in the last 12 months since we opened our clinic. And that is because in Australia, when it was rescheduled, what happened was there was a really big influx of people seeking access and seeking support and seeking self-medicine. So what happened was there was all these people that turned to the underground for access to psilocybin or MDMA or any of the other psychedelic medicines that we have. What happens was they weren't screened. Many of them weren't prepared at all. They were not informed of what they were going into. They then had very difficult experiences because either they didn't feel safe before having the medicine or they weren't supported and grounded during their medicine journey. They've then ended up re-traumatized, re-triggered with chronic insomnia and sleep difficulties, anxiety. I've seen the persistent perceptual disorders, which is almost like a psychotic episode where you continue to see fractals and things like that related from the psychedelics. It's like long-term psychedelic experience. So talking about the risks of going to practitioners that are not working in above ground settings is incredibly risky and not something I recommend anybody do, for the very simple fact that things can go incredibly wrong if biologically your body is not open and not ready or not suitable for these different types of medicines, you are not going to have a good time. And if you are not screened properly, that's where things can go incredibly wrong. But beyond that, you need to go through preparation. Going inwards is not, we go through life, we take on our experiences, and for people that have been through complex trauma, they're generally in survival from young childhood right through to whatever age they are now in adulthood. And if they're not prepared adequately and they have these medicines and they end up going in and just relive everything they've ever seen in their life, well, where's the support in that? Where's the ethical practice in that? There's not. And that's really why I'm such a huge advocate for the clinical guardrails, like you talked about, of supporting people properly through the screening, through the preparation, through the dosing, and then through the integration. And integration is arguably one of the most important parts of this medicine journey. Yeah. You can go off and have a psychedelic. It is not therapeutic unless you do something with what you've seen, with what you've taken away, with what message was in that for you.
Yeah, I mean, to your point, I went through a lot of those checks beforehand as well. Like we had, because I went essentially I had moved away for several years. I like started different businesses, and like everything was like super anxious driven, fun, but like also super anxious driven. Like you're trying to figure out if the company's going to have money next month, if you have to fire somebody, then I have to move locations again. Like there was just constant anxiety around me for those several years. And so when I came back, I had someone else in the entrepreneur community who had done this, who had seen, a few guys who I considered to be quite level-headed, who had excellent experiences. One of the guys sent their dad through it and said, Mike, he was a 75-year-old Romanian man. He came out 40% nicer and 30% less racist. And it was unbelievable. Wow. And so we had these sort of conversations where I was like, okay. And the people I went to were therapists. And we had a set and setting conversation. We had several therapy sessions to say, what are you here to do this for? So to your point, I went through all of those checks, but still came out with an unsavory, because even though the experience was quite fraught, I found it super fascinating, and I learned a lot almost immediately. Like I came out the next day, I was doing integration and journaling, and I felt like I had a perspective on life and the world that I just couldn't access before. However,
did you implement any of your learnings?
Yeah, completely. I mean, We'll get to that in a second. But afterwards, because of all the anxiety that was coming up, and I didn't know how to deal with it, and I wasn't sleeping well anyway, and then it made it even worse. It was brutal. It was really, really, really brutal. And so, again, to your point, I really would recommend people, if they're going to try these substances, to find someone that is trained, that is really judicious for how safe the environment's going to be. Mm-hmm. Before we go back to integration, how would you, so Australia is one of the only places where this is legal. In Canada, ketamine's legal. I still don't know what my views are on ketamine, but what if someone really has some issues that they want to try this, but they don't have access to something like your conscious clinic in Queensland? How do they, because I don't think for them the option to not do it would suffice. So how would someone go about attempting to step into this world very safely, even though maybe it's not above ground legal, as you're saying?
There are a number of retreats that are run by doctors, that are run by psychiatrists, that are run by trained, qualified psychologists, therapists that have been upskilled in this area to really hold that safe container. Some of those are around Europe, Peru, South America, and places like that. So there is a website and an organisation in Australia doing amazing work called Mind Medicine Australia. They have a list on their website of safe and approved retreat settings that people can go to actually be held in a safe container by qualified professionals in legal form settings. Okay.
Mind Medicine Australia?
Yep. I can give you the link for your show note.
Yeah, that'd be great. Thank you. Yeah, and to go back to integration, mm-hmm. I think the MDMA session had the most profound impact on the rest of my life. I talked about this during my very first episode of this podcast. For anyone who hasn't listened to it, the part that was most impactful is that, like, again, I went in there just to deal with this little bit of anxiety that had started developing over the last how many years, and I had a period of like 2 or 3 hours during the 7 or 8 that I was in the session where I was mourning the death of my grandparents. And what I learned about that really taught me a lot about love that I didn't understand before when I cut myself off to the pain of their passing. Because I was living away. I didn't have a chance to come back to the funeral. And I think even if I could, I probably wouldn't have mourned to the extent that I did in the weeks or during the session and the weeks after. Because even the week following the session, I just sat at my computer journaling, and I feel like I got a flood of memories back of my grandparents, and I was just sobbing at my computer going through all this. And it feels like I got all of these, because I told the therapist what I was going through in the moment, and she said, "Do you feel like now that you're mourning them, you got to say goodbye?" And I say, "No, I feel like now I got them back." And I didn't realize that I had really cauterized that part of my brain to them, because I know now that, like, you don't have, an expert in negative emotions told me this, like, you don't have love without sadness, and you can't choose which volume you turn down. You can't turn down sadness because it's convenient and it sucks, so you're just going to have love. That just doesn't work like that. And so if you turn down one, you turn down both. And so I feel like letting all of that out, that was so, I didn't even know it was on the table for that session. It got me back a lot of the memories of them, a lot of their love, a lot of their closeness, and it's really changed the way that I think I approach a lot of people in my life that I do care about and that I do love. And conversely, from the other session of MDMA and psilocybin, I don't really know what I took away. I mean, I feel a little bit closer to nature after that session, but nothing that I think affects how I interact with the world like the MDMA session.
It's interesting you talk about MDMA like that, because it is spoken about as the heart opener. MDMA releases all of our oxytocin and our love chemicals, and it's referred to as the love drug for that reason.
Right.
It's such a powerful medicine. And, if I was working for our government TGA, my suggestion would be that in mental health treatment, MDMA is commonly used, because if we really look at the roots of where so many of our mental illnesses come from, it's loneliness, it's trauma, it's difficult relationships, not just relationships with others and our significant others or our family or work colleagues, but relationships with ourselves.
Right.
And if we are allowed to have the space to really open our heart and feel what that love is, or remind us what that love feels like, it just can just change your perspective overnight in ways that you would never have imagined.
Yeah, I mean, all
For
of
now, we've
that.
got to work in the bounds that we've got. And in Australia, I'm so proud and blessed that we have access for MDMA for PTSD. I
Right.
take that as a win.
Yeah, that's an enormous win. I think where I hope for the future to go, at least, is, so there's a therapist I spoke to maybe a year ago on the show, and something she said really left a mark on me. That, so people sometimes that have these, these big traumas in life, they know that, when they're younger or whatever, know that in some respects they need to go get help. They find a support group, maybe they'll find a therapist. They know that there was this event that they can see that's very very stark in their mind. They know that maybe they should talk to somebody about this. But she said there's also a bunch of people who maybe grew up in a very, you know critically minded, critical, judgmental household, that also might experience worse outcomes growing up, because they don't know that they need to get help. It just seems like everyone else in their community. Like me, I've discussed this with a bunch of my friends in the Italian, Canadian community, and we just laugh, being like, yeah, that's what growing up Italian is. Like, you can't move in your house unless someone says, like, oh, you need to do that. Why are you doing that? Why are you wearing that clothes? Why'd you do that with your hair? Like, all of these things that, like, on the level comes on some level from culture, from love, and they are super funny in many respects. But how I understood what that therapist said is that, like, if you grow up in an environment where you're always questioned for what you're doing, or someone criticizes you, like, that leaves an imprint as well. And so I wonder if there's an element, and again, I don't want to conflate that experience with like PTSD that is much more stark and traumatic, but I think you see the parallels I'm trying to draw where you wonder if how many people would benefit from these heart openers because maybe they were taught to guard themselves growing up and they stayed a little bit closed because of an environment that wasn't violent. It just wasn't conducive to openness. Does that make sense?
There's something important in there too. And, I have a passion for men's mental health. And the three biggest killers for men are heart disease, lung cancer, and suicide. And the
Yep.
reality is when you're working with men, and I work with lots and lots of men in my clinical practice, is emotional suppression is how men survive. That's how men view masculinity. That's how they've been conditioned by society. And I really feel that if we're talking on a futuristic level of what this could look like, I really think the world would change overnight if even just men were invited to have these heart openers to really feel and process those emotions they've held and pushed down for so long across their life and across their development, because society told them they weren't allowed to feel that way because it's not masculine.
Right.
But
And
in
I would
reality,
go ahead.
when we look at what a man is, it's somebody that can wear their heart on their sleeve, that can, yes, sure, be stoic in the moment they need to be stoic in, but also own their feelings, have boundaries, but know who they are, not who society told them to be.
Yeah, I mean, I agree with a lot of that. I'm doing research on a project right now for about men and boys, and
Mm-hmm.
the add-on I'd like to give to that is a lot of the reason why men act in these ways is because it's not that society has told them that they have to be a certain way. It's like there's a disincentive for them to open up. They've been taught, I think, throughout their whole lives, from the interviews I've done and the experts I've spoken to, that anytime they try to either connect more with themselves or with other men, or even just be vulnerable in different scenarios with partners, etc., they're often punished for it. And so men learn that it's incentivized to be accepted by their peer groups or to be not punished. They should just be quiet and not feel their pain and not accept their pain and not connect. And so there's these two sides where I think they have this inability sometimes to connect with themselves. And if you can't connect with yourself, it's even more difficult to connect with other people. And if every time you try to open up, you're kind of socially, emotionally punished for that opening, you just learn that it's better to just not. So I think there's kind of two sides to this equation that I think it's going to take time, but I'm with you that I hope the future is more accepting of this kind of emotional revolution I think men are starting to go through, but it's quite a heavy lift for our societies. But I'm definitely with you.
It is, but I've got faith in our millennial generations and our alpha generations coming behind, because
Yeah.
they're really progressive. And I think there's so many of our systems that have served us very well in society, but some of them are outdated and it's time to change. And I think mental health is one of them. And that includes emotional intelligence and how we connect to each other and ourselves. That really needs to be taught and celebrated in so many ways, because if we don't do something, I don't want to know what the future looks like if we keep going this way.
Yeah, I do agree with that. I mean, on that note, I'd love to hear some success stories from things you've seen in your practice, for someone coming in and they were like A and they left like B. And because I think a lot of people that are skeptical about these things, for one, because they're illegal, which makes sense, but also there's that lack of control. Like if I think a lot of people self-medicate with alcohol because I think they feel
Yeah.
like it lightens the mental load, which on some hand maybe it does, but then the downward effects are quite awful, which we all know about now, from mental to physiological, etc. But I love people to hear more stories of people you've seen in your clinic that have come in and seen some real success, because I imagine you do this work because you see that all the time. I imagine you see a lot of really amazing journeys.
I do, and I think that's probably the blessing of my job is I get to learn so much about people and their
Mm,
experiences and the hardships they've been through, where they've come from and where they're going. In terms of being able to share like specific stories, I can't ethically. However,
right.
I will say that around supporting the people that I have supported that have come in following what you may refer to as a bad trip, I would call a challenging experience following plant medicines, self-medicating. I have seen people really turn a corner. And that's purely from the difference of A, being open following the medicine journey, but B, then also trusting me as the mental health professional to allow them to go into those corners of their life which may be driving those anxieties. I've seen some people turning some incredible corners. I won't really comment anymore on that. I don't want to out myself in things I shouldn't out myself in terms of
Right.
patient presentations. But I can say that the research that is coming out around these plant medicines is absolutely what we see across the board in clinical setting. You know,
Wow.
people liken these plant medicines to 20 years of therapy.
Yeah, I mean, I always said 10. So
But
that's
yeah,
pretty incredible. Yeah. So yeah, that's a shame that you can't share because I thought even if people really remain nameless, could you say like someone comes in with a X trauma and they leave, like is there any way you could say this by staying ethically within the bounds of privacy?
let me think. Um, okay. Um, I saw a patient. Um, I saw a patient following an underground medicine journey. That medicine journey was okay. It wasn't considered something difficult, but they ended up developing a phobia of spiders. They'd never previously had a phobia. Attached to this phobia of spiders was a lot of resentment towards their partner at the time as well. But in the time I've been able to support this patient over the last sort of 6 months, that patient has been able to understand where that phobia has come from, and we've remitted that. We've actually resolved that phobia. And it
Wow.
came from an experience in their childhood related to their family and their parents. Really, really impactful. And their medicine journey was actually unrelated. So I guess the power of these medicines, what they can do is they can actually bring other things to the surface for people that may be the thing that people end up in therapy for help and looking for support. And if there's one thing that I would suggest to people is to look for clinicians that are trained in psychedelic assisted therapy. Not everyone trained in psychedelic assisted therapy delivers the clinical therapy, but by having the knowledge of what the medicines are, what they do, how they get sat with, how they impact the brain and the body, that
Mm,
person is going to be more skilled in understanding how to help you psychologically with any anxieties that come up, any sleep disturbances that come up, any resurgence of PTSD.
right. Well, I imagine even if someone that is going to do an underground session, if they can
Mhm.
understand what the more MAPS protocol or the above ground protocols for dosage could be, maybe they could at least instruct these underground therapists to say, like, I know what you want to give me, but I would like you to follow this.
Mhm. Mhm. Some of the above ground therapists work in harm minimization realms. So I have also supported people through this. I have no recommendations and do not endorse any form of illegal access to plant medicines of any kind. But if someone comes to me and says that they are interested and what do they need to know, we talk about the risks and benefits. If that person then goes off and finds an underground therapist and does things on their own volition, that's fine. But part of my conscience is sharing that education and sharing that knowledge and making sure people feel informed making those decisions. I feel like a lot of the underground are not trained in these areas in many
Yeah.
cases and do not provide this information for people where they can feel informed as to whether that's a good idea for themselves or not.
Okay. Yeah, I appreciate that. And have you seen anyone come out of these experiences with I guess, a negative disposition afterwards, or they go on a negative trip or a bad trip? Like, how many of those are you seeing in practice right now?
Yeah, absolutely. There's actually a lot in Australia. So what happened was after Australia rescheduled psilocybin and MDMA, Australia does a big household drug survey every year, and the use of hallucinogenic drugs actually went up like 3 or 4% from normal.
Hmm.
So there was quite a significant increase in people experimenting and seeking these medicines. What ended up happening was there was a big increase in psychotic episodes. There was
Sure.
a big increase in anxiety. There was a big increase in, I think it's called can't remember the acronym, but it was like persistent hallucinogenic something disorder. And that's the like extended trip, basically. You're seeing
Wow.
fractals and geometric shapes and stuff, and people can get stuck in these realms. But I see a lot of like existential crises. I see a lot of people question themselves or the world or decisions they've made, and these medicines can really bring up lots of big feelings like that for people. And I would always encourage people to go and get some support. Never make a decision, a life-changing decision, within a few weeks after any medicine. It doesn't matter how you choose to go about it. Life decisions need to be put on hold for a period of time.
Right. And what about in your practice? Are you seeing any negative outcomes from the sessions that you're seeing coming out of the clinic?
So not in the clinic in Australia, we have had no adverse reactions, and that can be put down to our rigorous screening processes that we have. So that, I think,
Wow.
is something to be celebrating as a country.
Yeah, I mean, that's a pretty bold claim to have negative outcomes. I mean, I know the medical profession for anti-anxiety and antidepressants definitely cannot say that.
Yeah, no recorded adverse outcomes in Australia yet, and there's been 110 patients have been dosed in Australia.
Have you seen benefits through Mike?
You? I have a few patients that have disclosed that they do microdose, and yeah, it significantly helps the talk therapy process. Obviously,
Right.
I'm not involved in their access to the microdose, and I definitely don't condone it. I tell them that that's, my hard line. But in the very same hand, I also respect and appreciate their honesty to be open with me about that. What they choose to do is entirely their choice, but even they report how helpful that it has been for them in being able to manage their anxieties and being able to apply the therapeutic skills that we do or trauma processing that we work through.
Mm.
But there are some studies coming out about microdosing, so we'll see. We'll see what the future holds. I think the field is moving really quickly, and people need to be mindful of that too.
Right.
Just last week there was a study posted around psilocybin used in Alzheimer's,
Yeah.
and they found it reconnected the brain. And we know Alzheimer's is cognitive decline, so the brain deteriorating, which
Whoa.
is amazing, right? There is
Amazing.
currently a study underway using DMT for methamphetamine addiction.
Wow.
Yeah, and they're finding some pretty incredible results, like preliminary findings, but nonetheless.
Yeah, I mean, I think that's why I appreciate conversations with people like you that are in the field, but are also quite conservative for what they would recommend because they realize that adverse effects can be quite common if you're not screened for, mental health troubles that maybe you won't find success in these, and maybe you could benefit from many other modalities before diving into psychedelics. Because I really turn away from people who like will always call them, these are always plant medicines and everyone should take them, and they're like, I think we just need caution around all of these things where it
Yes.
yeah, and so I really would love to understand how it's going, and if you could be the head of the authority in Australia for licensing these, what would
Watch
be?
out, everybody.
Yeah, look out, look out. How would you like to see this space develop?
My future self longs for the day where this could actually be an option for first line treatment. First and foremost. Will
Right.
that happen? I don't know. My lesser ambitious goal is to really see access broadened. I've read a few of the research papers around how helpful these medicines are for eating disorders. Anybody that works in mental health field in any way, shape or form knows that eating disorders are some of the most complex and difficult disorders to treat. And some of the research findings have just been outstanding. We know that addiction is on the horizon in terms of some of the clinical trial research coming out. I would love to see addiction added to the list of people that can access these medicines too. So really my first thing is to see the scope broaden of the presentations that we can treat with these medicines.
Right.
As you mentioned before around the safety profiles, they're there, but these plant medicines are contraindicated by some health conditions, some medication, some predisposed family history of different disorders. So we need to be very careful.
Right. Yeah, because I imagine it's quite fraught with risk if someone wants to use it for substance abuse, but we're looking at these substances as the ones that are being abused, which it's typically not. And I mean, I do know plenty of people that are completely addicted, not plenty, but enough people that are addicted to ayahuasca, for example. They'll go once a month, or they're addicted to mushrooms, and I don't know if it's addiction like, let's say, a drug as perilous as cocaine, for example, but it's addicted to searching or addicted to being in that realm
Altered state.
of altered state. That's exactly. So yeah, so I can see how that would be troubling to be able to, because you have to figure out, okay, this person has been addicted to these several substances for this long. What dose do we give them of this new substance? Like, it kind of seems counterintuitive. And have you seen? Well, I guess you haven't treated anything like that. So have you seen people that have tried to use it for substance abuse?
Yeah, well, as you mentioned, like some of my clinical practice is around addiction. Lots of my patients have had their own experiences with quite heavy substances, cocaine, heroin, MDMA, things like that. And they have asked me about how psychedelics can be helpful in, treating addiction in that way. And we always go down the conversation of, in Australia, it hasn't been approved for that use, but the
Right.
research shows that it can be helpful. There's always an education component to that, but then also reminding the patient of, this is risky, and you've had these experiences before where you have abused or misused these medicines in different ways, and then they've led to either a psychotic episode, or they've led to high levels of suicidal ideation, or they've led to really deep depression. So people need to be incredibly careful. Again, always go back to your doctor, have a conversation with your doctor. If your doctor doesn't know, talk to your psychiatrist, talk to your psychologist, talk to your therapist. Somebody will know. If they don't know themselves, they will find somebody that can give you an answer.
Right. Well, that's great. I mean, I appreciate all of your work on this. And before we start talking, you said that you've been the first clinic that was granted legal status to administer these in Queensland, Australia. And so congratulations on that. It seems like you're so passionate about your work. I think I'm sure your clients, your patients are safe and happy to be in your care.
It's incredible, and we're so proud to be able to bring access to our local community. It's much needed. It really is.
And what would you say to people out there? Yeah, actually, it's hard because if everything's illegal, then it's hard not to say something positive without. Yeah, so I'll let you take it. How would you like to end for all the people out there that are interested in this conversation and different countries?
Thanks for listening this far. If you haven't watched the Netflix series of Michael Pollan, How to Change Your Mind, do so. It's incredible. If you're a bookworm, go read the book. It's in so much more depth than the Netflix series. If you are interested in learning more about ketamine, there was a documentary on Netflix. Can't remember, something about Maya, it might have been called, and it's about a young girl that had a pain disorder, but she was treated with ketamine. And the family talk about how helpful that was in managing her pain. So again, these are sort of some resources and areas you can go to start really learning and, I guess, helping yourself expand your own awareness as to what the potential could be with these medicines. Again, and Medicine Australia have a list of retreats that are run by doctors in legal settings around the world that may be able to support you. Please jump on that website, look for those clinics and reach out to them. If you do choose to go in the underground, please be safe. And if anything, if you need support, find a local psychologist in your area that can help you navigate thereafter to really integrate properly. I wouldn't recommend underground, but if that's what you feel you need to do, then please just go with care.
Thank you, Shay. And I will put all the links where people can find you and find those retreats where they have approved licensed therapists so they can be safe. And I'll provide all the resources for everybody. So thank you again so much for your time and all your work.
You are so welcome, and I hope your listeners enjoy.
So thanks for listening to No More, No Less. I appreciate the time you spent with me today. So please subscribe and rate the show if you enjoyed it. It'll help me create more amazing content and get that next little bit of validation that I so deeply crave. If you did enjoy it, well, that sucks. But to make sure, I think you should listen to my next 10 episodes and then decide. I mean, come on. Rome was not built in a day. I'm just getting warmed up here, guys. So thanks again. See you next time.